Hi everyone, it's Dr. Andrew Orr here. As I said, this year I wanted to come on and talk about some of the facts and fallacies, I suppose, the myths around certain things that we hear and some of the things that we think are facts and that aren't really facts, and some of the things we hear that around the places that we'd like to know a lot more about. One of those things that I often get asked about is the Mirena, which is an intra-uterine device, which has been around now for quite a while. And it is one of the sort of main medical options that we use now for birth control for various reasons. But it's also used to help with heavy bleeding for women that get heavy bleeding, especially those with adenomyosis, or maybe those with endometriosis and adenomyosis, because it can also help with suppressing, I suppose, some of the microscopic implants from further expressing into the body, especially to do with endometriosis, and also helping the control of adenomyosis, but more around the symptoms of heavy menstrual bleeding. So basically what the Mirena is, it's 52 milligrams of a progestin. It's a synthetic progestin, and it's the same as some of our pills like Microgyne and Levlin and so forth have the same progestin in it. But the reason why and it's progestins only. So the reason why that some women can't actually have estrogen. So say if you get migraines, and especially migraines with aura at any age, that comes under what we call category 3 or category 4. So category 3 is basically the risks outweigh the benefits, basically. And then category 4 is basically where it's an unacceptable health risk. And one of those unacceptable health risks is stroke with estrogen. So that's why a lot of women that have migraines can't have a pill containing estrogen in it. And they have to have a progesterone only option because the risk of stroke is quite high, and things like DVTs and things like that. So yeah, that's one thing that a women need to know. So if you get migraines with aura, you shouldn't be on a pill containing estrogen at all. Should be on a progesterone only option. So this is where the things like the Mirena have actually come in. Now, I hear a lot of things about the Mirena, but let's talk about what it does first. Well, as I said to you, it is a contraceptive. Basically, it stays in for 5 to 6 years, depending on what it's used for. 6 years it can be left in for to prevent pregnancy, and 5 years for heavy menstrual bleeding. So most of the time after 5 years, they're taken out. So it enters a tiny, tiny, minute amount of progestins, and those progestins only act here only. So this is a uterus. It's pretty much like a life-size model of the uterus. It's not big by any means. Like a lot of women think, you look at pictures and they look quite big, but they're not really. So they're amazing structures, really, because they can expand and hold a baby, all kinds of stuff. So, but when we look at this uterus, so all it does is act locally. Only a very minute amount of it may enter the bloodstream, but it's so minute that it's negligible. And we'll come back to all this in a minute. The other thing it does is it actually thins the uterine lining. And that helps to basically stop implantation happening. But at the same time, it can also inhibit the movement of sperm. And at the end of the day, they don't really understand how it all acts to make all those things happen. But it does. The other thing it does is also help thicken the cervical mucus, which actually stops sperm and could hinder sperm from being able to swim as well. And how that all happens, they aren't entirely sure, but it is one of the safest contraceptive. Is about 99.9% accuracy rate. There's nothing that's 100%, but that's pretty good considering. So that's how it works. Now, one of the things that I always hear is, it's like anything. When someone has a bad perceived reaction to something, that's all we hear about. We hear the bad things. It's like bad Google reviews or bad reviews on about a business or something. There might be 10,000 good reviews and then there might be 10 bad reviews. Well, guess what people will float to? The bad reviews. Rather than going through those bad reviews and looking at those people and going, well, every time they make a review, they make a bad review. So a lot of the times it isn't the actual place, but we focus on it. And then again, we cherry pick because the bad reviews. We always want to go to the bad option first. But I do want to say that it's one of the things I get told about often, and a lot of the bad side of things are perceptions. And I want to explain some of those perceptions to you and why people think, and because really at the end of the day, the Mirena is probably one of the best medical options there are to control things like endometriosis, regrowth, and help with adenomyosis and heavy bleeding and stuff like that. And again, because it's left in for 5 years, you don't have to take a pill. It hasn't got all the systemic effects of the pill, which I'll talk about in a minute. Now, as I said before, it's got 52 milligrams of a progestin in there. Now, I'll just, there we go. I'll bring it up on here and let's have a look. So you can see this is the Mirena. This is how big it's tiny, right? We've got to put all this into perspective. It's tiny. And again, it's got 52 milligrams of a progestin, and that progestin, or like progesterone, it's a synthetic progesterone, that's got to last for 5 years. Now, the way that some people talk about it, it's like you've got a whole bucket load of progestins in there. It doesn't work like that. It's just this tiny little amount that leaches out. And part of it as well is again about the cervical mucus. And again, it's about thinning the lining. It's not what a lot of people perceive. Now, one of the things, as I say, it's tiny. It's like the pen. It's like the tip of this pen, about that. There we go. It's about how big it is, tall it is, and it's a lot thinner than that. It's as thin as a. I haven't got one here, so I was going to show you, but it's as thin as the inside of my pen, right? And it's only tiny, as you saw on there. And if we have a look at the Mirena website, I'll bring it up now. Let's see if we can bring up the Mirena website. Here we go. I'll just change that. I'll bring up what is it about the Mirena. Now, here we go. Hang on, folks, technology. There we go. All right. So you can see towards like a packet of sugar here, a tiny little packet of sugar. And obviously it's from a US site, so it's in inches and not in centimeters. But you can see a couple of little dice beside. So it's tiny, and it goes and it fits inside, put inside a uterus, and it sits there for 5 years. And it's got strings on it as well, and we'll talk about filling the strings and all that stuff in a minute. So let's look at the first thing. One of the first reasons why a lot of people say, oh, they wanted it out is because they got pain afterwards. Now, I'm going to tell you now that the Mirena should never be put in without anesthetic. It really shouldn't. You should always be sedated, especially if you're a young woman or you haven't had children yet, because this cervix hasn't been dilated ever before. And by putting it in, you're going to have a lot of pain. So by stretching that cervix, you're going to create spasm through there and a whole lot of pain, which is, well, it's not like having birth, but it's painful because you're stretching. The only other time that gets stretched is when you have a baby, and it slightly dilates when you have a period. So that's why some women get, discomfort. Period pain's not normal, remember? The one thing I tell women, period pain is common, but it's not normal. One thing we have to get through to women, period pain is common, but it's not normal. Come back to that one in a minute. So that's why you should always have it under sedation, because then when you're sedated, all your muscles are relaxed, everything's relaxed, you don't feel anything. The Mirena can be put in effortlessly, and it should be put in by a gynecologist. They should never be put in without sedation and just in a room somewhere. And I know that they do, and there's people that do, but that shouldn't. Especially if you haven't had children before. If you've had children before and you've had the cervix dilated, yes, you can have it put in the GP's office or somewhere like that, or in an outpatient clinic in a hospital somewhere. But it will still hurt. It's not going to be this joyous thing and, it's easy done, blah, blah, blah. So often when they get put in, and because the cervix hasn't been dilated, it's going to cause this spasm, this constant spasm there. It's like anything, you overstretch any muscle or tissue in your body, you're going to get spasm. And that's what happens to some of these women, is that they have it put in, it's traumatic, which then creates anxiety and everything like that, which creates further spasm through the pelvic floor, because the pelvic floor is all through there as well. So that sets the pelvic floor off. So you've got the pelvic floor firing off, you've got the cervix firing off, then the uterus is like what we call an irritable uterus, which we see sometimes with just before going into labour. And the whole thing becomes upset. But if you had a specialist dealing with you and you did it under sedation, less likely that that's going to happen. The other thing, if it does happen, there's medications and things that you can be given, as well as anti-inflammatories, but you may also need to be given some other progestins, some extra progestins in the form of a tablet for about 4 days, and it will settle the pain down immediately. There are other things like anti-prostaglandins and stuff like that that can help, but you need to talk to your specialist about all that. But that's how it should be managed. And normally, when it's managed properly, if you do get that spasms and those pains and those cramps, it'll settle down within about 4 to 5 days. That's the truth. Now, I know a lot of women, they haven't had all that. They've just had it put in, left with the spasm, and it gets to a point where it becomes uncontrolled. Then the anxiety kicks in, it becomes worse and worse. And then the next thing, they're knocking on a door going, take it out, take it out, take it out. It's just because it wasn't managed properly. The other thing that what I often hear is that it interferes with people's emotions. Now, the other thing I need to tell you is it doesn't have an effect on people's emotions. And the emotions that people have and those mood and emotional disruptions that they have are already pre-existing. Whether people like to admit it or not, they're pre-existing. And that having the Mirena put in causes a trauma, and that trauma triggers a response. And then it also triggers a response in the brain, in the chemicals in the brain, and that's what it's from. It's a trauma response, not a response from the Mirena or hormones. So that's another thing we need to talk about, because a lot of people, I'm sorry, do have a lot of uncontrolled anxiety, mood disorders and stuff like that, that they aren't seeing a psychologist for. And any form of trauma anywhere, could be any trigger, could set them off. But what happens is that once I said, like, they get it put in when they shouldn't, it should be under sedation, that triggers a trauma response, that sets the emotions off, that sets a panic response off. And then some people are sitting there thinking constantly, I've got this thing in my body because I've heard all these negative results online, they Dr. Google, which is bad. This is where the bad side of Dr. Google, because there's a lot of misinformation and it's given to people by lay people or the general public rather than proper medical profession or proper research. And I've talked about research versus a Google search before. And so this feeds into that anxiety, and especially in some of these social media groups, where they are all feeding into each other's anxieties and mood disorders and stuff like that. And it just sets that off. And they're sitting at home and they're constantly focusing on it. And as I said again, what if you the proper treatment, a few anti-prostaglandins and also some hormonal treatment for 3 or 4 days, that would all settle down. And then all that would go, the anxiety goes away and stuff like that. But people blame the Mirena for the whole lot. Oh, it's that, it has to be the Mirena. The other thing is, I said to you with the progestins, it only acts locally just to thin the lining, and hardly any, like the minutest amount, negligible amount, will actually enter into the bloodstream. So it acts locally, not systemically. So that's another reason why it doesn't interfere with the hormones and stuff like that. That's a perception rather than reality. And again, it's fed by people that perceive a negative with it. There are individuals that have, again, like anything, when they've had it put in, they get toxic shock syndrome. They do, because again, they shouldn't have it put in without being sedated. It just should never be done that way. The other thing is things like weight gain and that, again, it doesn't affect weight. So people that are saying it affects weight are blaming something else rather than themselves. Weight gain for most people is what they put in here, lack of exercise. There could be other underlying issues that aren't being addressed, but I know that 100%. Again, it's not systemic, it only acts locally. So there are a couple of the myths around that, because, you know, as much as some people don't, you know, might not want something in their body too, so then they start focusing on that. Oh, there's this thing in my body, you know, it's like an alien, it's going to do something to me. And then I went onto a site and I saw this woman was saying the same thing. And again, it's feeding into that anxiety, and then there's other people are feeding into each other's anxiety, and they're exactly the same. Sure, in an ideal world, it'd be great if we didn't have to do all those kind of stuff. But the thing is, for heavy menstrual bleeding, it's one of the most conservative measures, besides having it put in, that you can do. Other than that, for some women that have adenomyosis and have severe bleeding, sometimes even putting the Mirena is not enough. Some of them are then taking progestins, that's still not enough. Then some of them using like tranexamic acid, that's still not enough. So the only thing left is a hysterectomy to get their quality of life back. So we have to talk about that, because the reality is you do all the conservative measures first, like the pill, the Mirena, and there's other things, you know, there's complementary medicines that can be used alongside to assist. You can do all that stuff, but it's not, you know, with heavy bleeding, it's a whole different story, and you become anemic and all that. So you've got to watch it. But that's a whole other post in itself. I've talked about iron deficiency before, and we'll talk about heavy menstrual bleeding at another time, and adenomyosis and that. The main thing is to just go around the facts and the myths about the Mirena. So there's some of the things I wanted to talk about, and explain that a lot of people's, that the negative stuff, a lot of it is actually people's perceptions rather than actual things happening. Others, it's driven by anxiety. And the other part is that it's been mismanaged from the start. And again, some of that all gets back to how it was put in. And again, I said, if you've had 2 or 3 kids, yeah, sure, you could probably go in and have it put in just locally, and, you know, it'd still be painful, as I said. But if you're a young woman that's never had children, you should never have the Mirena put in without being sedated. And I'll say that over and over and over again, you shouldn't, because the cervix never been stretched before, and that's going to cause you a lot of pain. Even when you do get it put in under sedation, there's still going to be some amount of spasm when you wake up, because you have the cervix stretched, right? And when all the anesthetic wears off, you're still going to have some amount of pain. But again, that can be settled down quite quickly. The only other thing that we see a lot is that, you know, it can take between 3 and 6 months for the bleeding to fully stop for some that have got really bad heavy menstrual bleeding, and they might just get down. It should bring it down quite quickly. Usually within about 8 weeks, it will settle a lot of bleeding stuff down. And most of the time, women on the Mirena actually don't get a period at all. Some do, some still get their period and things like that. But other than that, that's really what it's for. It's one of the main things. But again, if you don't want to, and you that, you really, there's something in you goes, I don't want something in my body, then your only option is the pill. But the pill is different because it is, and depending on what pill, and again, there's different forms of pill. There's progesterone only, and then there's combined hormonal contraceptives and stuff like that. But then you have to be careful, like I said, with things like migraines and your risk factors and all kinds of stuff in which pill you should be taking. And then some pills have higher amounts of progestins in them and lower amounts of estrogen, and some have higher amounts of estrogen, lower amounts of progesterone, depending on what it's for. But pills are systemic. They can affect the mental side of things. They can cause weight gain. They can cause bloating. They can cause a whole heap of things as well. And then they can mask stuff as well. So that's what you've got to weigh up the options. And really, when we look at things now, Mirena is one of the better options for side effects, for pregnancy, contraceptives, and also helping heavy menstrual bleeding. It's one of the better forms of things to control heavy menstrual bleeding as well. So I thought I'd come on and talk about it, despite, as I always say, I'm always very holistic, where I use a multimodality approach. I still will come on and talk about things, especially when there's negative things talked about something and some of those things actually aren't true. And again, their perceptions. And I know there'll probably be people get on and go, but. And you can get on and go, but I'll also tell you why you're actually wrong and why your perception is wrong as well, because you just might not have been managed. You might have heard something in a group that's totally wrong. And again, someone in the social media group or in some of these toxic groups, because there are toxic groups out there, they're not trained professionals. It's just their personal opinion. Again, I could drink some water, and just because every time I drank water, I got some sort of reaction, or I've said, felt like I was acidic. I go, well, water gives me acid. Water gives me acid. Yes, it does. And again, it's all that sort of confirmation bias, when the reality is water's not going to give me acid. It's probably something I've eaten prior to that, but the last thing I had was my water, and then the acid came up just coincidentally, and then I'll blame the water. It's the same for some of this stuff. I've seen people take medications, they blame the medication. It was nothing to do with the medication, something completely different. I've seen people with food poisoning blame stuff, and it was actually themselves poisoning them by sticking their fingers in their dirty fingers in their mouth and got grit and bacteria under their fingernails, so they poisoned themselves. So it's perception versus reality, and I thought I'd come on and talk about the reality of the Mirena. And again, if it's not an option for you, that's fine, but we need to talk about what some of the positives are of it, rather than always these negative. And again, as I talked about these negative reviews, people are drawn to the negative rather than the positive. The reality is that 9 out of 10 women will have no problem with the Mirena. 9 out of 10. And you'll get that one person out of 10 that will. And again, out of that person, there are genuine reactions that someone could get. There are genuine, because nothing has no side effects. Not saying that there is none, but a lot of the side effects are also perceptions of it. And just if you had a proper professional, like seeing your specialist, they'd be able to talk you through it, tell you what's happening, why you've got cramping, why you've got this, why you've got that. Also, the other thing with the Mirena is teaching women to feel for the strings. You should feel for the strings probably about once a fortnight, to make sure it's there, to make sure it hasn't dislodged. It's rare that it moves, but some can, and then some women can have an incompetent cervix and spit it out as well. So there are side effects, and you should talk to your healthcare professional that's actually putting the Mirena in, and they should talk to you about things like feeling the strings. What are some of the things to look for, how long you might be bleeding, blah, 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 and all the kinds of things with it. All right, I thought I'd just come on and talk about it. Hopefully it gives you a little bit more understanding into it. I'm sure I'll be there to listen to some of the comments. and also answer some of those comments as well. Talk soon. Bye.